Hey everyone, thanks for checking out Project Starlight, the Addiction Workshop. It is my hope that I inspire and motivate a bunch of you young docs and even you practicing docs to help out. You know, we weren't trained, we never learned how to deal with someone struggling with addiction in school. And for many of us out in practice, we see this every day. And it may not even be our patients, it is our friends and our families. So this really is a workshop that everyone can take. It is a primer, so it's really going to be a stepping stone for some of you guys, but for others, this is all you're going to need. You may not think that you want to practice, you may not want to help or treat people with addiction, but you need to know where to refer them to. You need to know how to ask the right questions and how to screen for it. So what I wanted to do is give you guys a little bit of a background into what's going to be covered over the weekend, and there are 10 modules, and I thought this was a great opportunity for me to give an overview of these modules. So the Friday night starts off talking about what is mental health. There's a spectrum, you know, where on that spectrum is someone unwell. We're going to look at some of the statistics in Canada, we're going to talk about concurrent disorders, and we're going to really talk about stigma and how stigma plays a role in perpetuating addiction. You know, we don't learn this in school, and we need to have these skills. We need to talk about it, and we need to be raw about it. Another thing we're going to be talking about in Module 1 is the historical context in Canada. We're going to be talking about how politics and laws have created, in my opinion, a bit of an addiction issue. And we can see it in current healthcare right now. They're really trying to focus in on helping individuals with mental health and addiction. We're also going to be talking about the medical model versus the moral model of addiction. We're going to be talking about addiction as a chronic disease. Module 2 is really going to be focusing in on what is addiction. We're going to be talking about the neurobiology of addiction. So look at its definitions, what is an addict. We're going to look at how we can destigmatize some of those terms. You know, I hate actually hearing the word junkie and cracky. So we'll talk about being a little more compassionate, and we'll talk about being more culturally sensitive to this. We're going to look at the science of addiction, the dopamine reward system, negative and positive reinforcers. We're going to be talking about addiction as a compulsion. We're going to be looking at the physiology and the psychology of addiction. We're going to do a nice little overview of neurotransmitters and neurotransmission, and the different types of receptors. So if science and anatomy is your thing, this is the class or this is the module that's really going to be able to cover that. Module 3, we switch into the individual substances. So we're going to cover everything. So there'll be a bit of a review of the neurotransmitters, but we're going to be looking at the major classes of substances. So the stimulants, the depressants, the hallucinogens, and the opiates. The types of chemicals that we're going to be looking at are cocaine, amphetamines, alcohol and opiates, benzodiazepines, cannabis, nicotine, MDMA. We're also going to be talking about some of the more behavioral addictions like gambling, sex addiction. We'll look at the different medical treatments available. What really is currently accepted. We're going to look at signs and symptoms, so what to look for in an addicted patient. We're looking at the toxic side effects, the withdrawal effects, and talk about what is tolerance. There'll be a lot of debate in this class. We'll look at addiction as a disease. We'll look at addiction as a moral issue. And there's a lot of controversy with that. In Module 4, we'll be talking about the different testing and assessment that can be done. And so that's, for example, pre-screening questions. We'll be looking at the audits and the CAGE questionnaires. We'll look at the DAST-20. We're looking at SBIRT, so screening, brief intervention, and referral to treatment. That's a must for all NDs. We'll also talk about the DSM-5 and some of the changes that occurred from DSM-4. And we'll be looking at the dual diagnosis that's quite prevalent when it comes with dealing with addiction. Module 5 goes into more of the medical treatments. So what are some of the conventional treatments available? Again, we'll cover the medical model versus the moral model, and we'll also look at harm reduction. Living in Vancouver, this is the hub of global harm reduction. So it's actually a great opportunity for me to share some of the stories that I've experienced here in Vancouver. We're also going to talk about outpatient versus inpatient treatment. So what is the difference, and why would you send someone to an outpatient versus an inpatient facility? We'll also look at the disparaging aspects of private versus public. There is a lot available there for private pay if you've got the money, and there are spots for public, but often there's a large waiting list. We'll look at the process of addiction, detoxification. We'll look at different rehab facilities and some of the conventional medical treatments, such as drugs, vaccines, and cognitive behavioral therapy. So moving from Module 5, we'll get into Module 6, and Module 6 is really about recovery and aftercare. So this module is going to be really great for people that are already dealing with someone with addiction. It's going to talk about some of the addiction recovery coaching techniques that are available. We'll be looking at what triggers an individual and some of the coping skills. We're looking at goal setting and planning. We'll look at things like the hierarchy of values. So how do we actually have a person look at what their values are and have them hold themselves up to those values? We'll talk about the importance of balance and look at the wellness wheel. We'll also look at how we can get recovery capital and how we can build that in an individual. And then lastly, we'll talk about the circle of support. So who do we need to bring into our circle of friends, our network, to help us? Module 7 focuses on naturopathic treatments, and that's the meat and potatoes of what I love. I've worked with this area for quite some time, and so we'll talk about neurotransmitter synthesis and some of the vitamins and supplements that can be used with that. But I want to stress, it's not just about neurotransmitters. We'll look at cofactors and vitamins, and of course some of the amino acids. I'll also introduce you to some of the novel IV treatments that are available out there. I'm sure we've all heard about it, but I want to stress that treating addiction isn't just about putting a needle in someone's vein and giving them vitamins. It's a lot more. We'll talk about NADA, acupuncture, auricular therapy, botanical medicine, and we'll give a nice overview of some treatment protocols there. Then moving into Module 8, we're going to be looking at the role of the allied health professional. So not just the naturopathic profession, but registered clinical counselors. We'll look at other things like TCM, social working, all those different fields, those professions that actually help make this work. This will be an introduction to some basic counseling skills like motivational interviewing. We'll learn to ask the hard questions. We'll look at the role of the family unit and family dynamics. Look at how to structure an interview and work through the trans-theoretical model of change. Module 9 is going to be more about the community. And so we'll go over some resources that you guys have as NDEs to be able to send your friends and family to. So how to connect the patient to these resources. We'll look at things like crisis management. So what happens if you have a patient that's dealing with suicidal tendencies? What do you do with that? What happens if you've got someone in your practice and they're telling you that they're going to end their life? We don't learn this in school. We need to learn this stuff. So we'll do the overview of the various programming, and we'll look at the role of various support workers. And then last module we're going to deal with, it's not really the module that I'm going to cover, but Dr. Tanya Mate is going to cover this. Her work with her father-in-law, Gabor Mate, using alternative treatments. So whether that's the use of ayahuasca, the use of things like MDMA. There's a big study right now going on with MDMA. These aren't modalities that we're able to use currently, but that could change. And it's important for us to realize that there's other things out there. Addiction is different in different cultures, and different cultures deal with addiction in different ways. So this is just going to be an introduction to some of the other types of treatments out there. Of course, I'm not condoning this use since it's not in our scope of practice, but it's important for us to know this because our patients are going to come in here asking about it. So I encourage you guys all to ask questions. You're welcome to send me a message. I'm happy to answer that. This, like I said, is a passion of mine. There are too many people struggling with addiction that fall through the cracks, and we have the ability to make a difference. So, you know what? I'm really excited about this, and I hope I see you guys there. Thank you so much, and take care.